Are there any questions? I call the Leader of the Opposition.
Speaker, my questions to the Minister for Health. Rebecca from the City of Casey is one of many Victorians who required urgent surgery, in her case to deal with complications from a double mastectomy due to a 2021 breast cancer diagnosis. Her prognosis includes triple-negative breast cancer and a BRCA1 gene, which is the most aggressive and dangerous of breast cancers, so every day with her daughter is precious. She needs surgery urgently, but due to the elective surgery bans, May is the earliest it can be done. Her chemo's been delayed 6 months. Her tumour has doubled in size. Why won't the Minister allow the bans on elective surgery to be fully lifted so that Rebecca and thousands like her can get the vital surgery they so desperately need?
I call the Minister for Health.
Can I thank the Leader of the Opposition for his question? And as honourable members will know, it's not my practice in this place, a long-held practice, to discuss particular circumstances of particular members of the Victorian community. Nonetheless, should the honourable member seek to provide myself and my office with the particular details of this case, I will, of course, pursue those in confidence with him and that person. But in regards to the broader issues that the honourable member raises in regards to the delays on non-Category 1 elective surgery that are in place at the moment, have been in place for the large part of January, I was pleased to see that in regards to the initial lifting of those restrictions, that commenced yesterday. But in regards to the reasons as to what the proposition as to why these measures need to be taken, measures that nobody in the entire state, and indeed in the entire country, given that similar measures are in place right around the country, nobody wants to see these measures in place for a moment longer than they need to be. And they are in place because at the moment our health system is under pressure like never before. That no one's lived experience in our health system has seen the pressure and the demands of how COVID-19, and particularly the Omicron variant, which has seen record levels of infection and change of transmission right across our community. No one has seen these pressures. That has seen, at its peak, over 5,000 people furloughed or close contacts or indeed immediate cases taken out of our public healthcare system. It has seen hundreds and hundreds and hundreds of cases of highly infectious cases of COVID-19 in our hospitals. It has seen even higher levels of hospital in the home care and wider care in the care of our hospital system in the community. Put all these together, the rationale of sadly having to prioritise the sickest people in the priority of having our opportunities to deal with in the sickest location, in the most important locations of our hospital system, has necessitated these measures to be put in place. They will not be in place for a moment longer than they are necessary.
Order. Order. The Leader of the Opposition on a supplementary.
Noting that Rebecca twice contacted the Minister's office regarding her dangerous breast cancer diagnosis, I further ask if the Minister could guarantee that with new variants of COVID, he won't shut elective surgery and IVF all over again.
Order. 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 Members on both sides of the chamber. Minister for Health has the call.
Thank you, Speaker. So, predicting the future in a global pandemic is a mug's game. And indeed, you can pretty much pick the mugs who do it. And you can pretty much predict the mugs who one day call for an abolition of masks and for a scrapping of all the public health orders, only to pivot away from that.
Order. The Minister will resume his seat. Order. I ask the Minister to resume his seat. Members on both sides will come to order. The Leader of the Opposition on a point of
Speaker,
order.
on a point of order, I didn't ask for the minister to comment on the opposition or anyone else. I asked for a ministerial guarantee that elective surgery, like other states, won't be shut in Victoria again.
Order, order. Members on my right. Members on... The Minister for Government Services is warned. I take the opportunity... Order! I take the opportunity to warn all members. I couldn't hear the minister's answer clearly enough to know whether or not the point of order was an accurate one. I asked the minister to come back to answering the question.
I can assure the honourable Speaker that I was not reflecting on the Leader of the Opposition, but if he takes the assessment of a mug as a reflection on him, then that's up to him. In regards to the issue around what the future will bring, this government will continue to engage with the private hospitals, with our public health sector, with the workforce and all those who need that public health system to make sure that it stays effective and as relevant to their ongoing response to this global pandemic.
Minister's time is concluded.